I'm Dr. Steve, and I'm a urologist here in the United States. For more than 2 decades, I've had the privilege of sitting down with thousands of men, just like you, to talk about one of the most common sources of anxiety as we get older, our prostate health. Let's be honest, it's a topic that brings up a lot of questions and, frankly, a lot of fear. The fear of getting up 3, 4, 5 times a night. The fear of a weak stream or an urgent, uncontrollable need to go. And of course, the quiet, persistent fear of that word, cancer. I see that fear in my office every single day. But today, I want to reframe that conversation. I don't want to talk about fear. I want to talk about power. The power you have, right now, to take control of your health through the small, daily choices you make. Because the health of your prostate isn't just a matter of genetics or bad luck. It is profoundly influenced by your habits. And today, we're going to pull back the curtain on the 10 most common and most harmful habits that I see sabotaging the prostate health of men over 60. Some of these might surprise you. Some might seem like common sense. But my goal is that by the end of our time together, you will have a clear, actionable roadmap to protect this vital gland, reduce your symptoms, and live with more confidence and less worry. This isn't about a life of restriction. It's about a life of intention. So grab a cup of coffee or water, settle in, and let's talk about how you can give your prostate the best possible chance to serve you well for decades to come. Habit number 1, playing the waiting game with your bladder. Let's start with something incredibly simple. Something most of us do without a second thought. You're watching the game, you're in the middle of a project, or you're on a long car ride, and you feel the urge to urinate. What do? You hold it. You tell yourself, I'll go in a few minutes. This seemingly harmless habit of playing the waiting game can be incredibly detrimental to your prostate health over time. Here's why. Think of your bladder as a muscular balloon. Its job is to store urine and then contract to empty. When you consistently ignore the signal to go, you are overstretching that balloon. Over time, this can weaken the bladder muscle, making it less efficient at emptying completely. What does that have to do with the prostate? Your prostate gland sits directly underneath the bladder, and the urethra runs right through it. When your bladder doesn't empty fully, the leftover or residual urine can become a breeding ground for bacteria, increasing your risk of urinary tract infections, which in turn can inflame the prostate. More importantly, a constantly full bladder puts continuous back pressure on the entire system, including the prostate itself. For a man who may already have some benign prostatic hyperplasia, or BPH, that's the common, non-cancerous enlargement of the prostate, this extra pressure can worsen symptoms like a weak stream and the sensation of incomplete emptying. What I tell my patients is this: treat the urge to urinate with respect. When your body sends you the signal, listen to it as soon as is practical. Don't make a habit of pushing it to the limit. It's a simple shift in mindset that can protect the delicate mechanics of your urinary system for the long haul. Habit number 2. Living a sedentary life. In our modern world, it's easier than ever to be stationary. We sit to drive, we sit to work, we sit to watch TV. But for your prostate, a sedentary lifestyle is like creating a stagnant swamp in your pelvis. Your prostate, like every other organ in your body, relies on good blood flow. Circulation brings in oxygen and vital nutrients, and just as importantly, it flushes out metabolic waste and inflammatory byproducts. When you are sitting for prolonged periods, blood flow to the pelvic region becomes sluggish. This lack of circulation can contribute to a low-grade, chronic inflammatory state, which is a key driver of BPH symptoms and is increasingly linked to prostate cancer risk. Furthermore, a lack of physical activity is a direct contributor to weight gain, particularly abdominal obesity. That extra fat around your midsection isn't just inert. It's a hormonally active tissue that produces inflammatory molecules and can disrupt the balance of hormones like testosterone and estrogen in your body, a balance that is critical for prostate health. The solution is simple: move. I'm not telling you to go out and run a marathon. I'm telling you to break up long periods of sitting. Get up and walk around for 5 minutes every hour. Take the stairs. Go for a brisk 20 to 30-minute walk each day. Activities like swimming, cycling, or even yoga can dramatically improve pelvic blood flow. Think of it as turning that stagnant swamp into a fresh, flowing river. A patient of mine, a 70-year-old retired accountant named George, was getting up 5 times a night. He was exhausted. He did nothing but sit, read, and watch TV. I challenged him to one thing: walk for 30 minutes every single day. After 2 months, he came back and told me he was only getting up twice a night. He had more energy, and he'd lost 8 pounds. The only thing he changed was he started moving. Habit number 3. Overconsumption of red meat and high-fat dairy. Diet is a cornerstone of prostate health, and this is where many men unknowingly cause problems. Specifically, a diet high in red meat, like beef and pork, and high-fat dairy products has been consistently linked in large-scale studies to a higher risk of aggressive prostate cancer. There are a couple of reasons for this. First, these foods are high in saturated fat. A diet high in saturated fat promotes inflammation throughout the body, including in the prostate gland. Second, when you cook red meat at high temperatures, like grilling or frying, compounds called heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs, can form, both of which are known carcinogens. There's also a hormonal component. Diets high in animal fats, particularly from dairy, have been shown to increase the levels of a hormone called insulin like growth factor 1, IGF-1. While IGF-1 is important for normal growth, elevated levels in adulthood are strongly associated with increased cancer risk, including prostate cancer, because it can stimulate cell proliferation. The change I recommend is not to become a vegan overnight, but to shift the balance of your plate. Think of red meat as a treat, not a staple. Aim for no more than 1 or 2 servings a week. Instead, focus on prostate-friendly proteins like fatty fish, salmon, sardines, trout, which are rich in anti-inflammatory omega-3s, and plant-based proteins like beans, lentils, and chickpeas. For dairy, consider switching to low-fat or non-fat options, or explore alternatives like almond or oat milk. Small, consistent dietary shifts can fundamentally change the environment in which your prostate exists, from one that promotes inflammation to one that fights it. Habit number 4. The fear of fluids, chronic dehydration. This one sounds counterintuitive, I know. If you're already struggling with frequency and urgency, the first thing you want to do is drink less, right? Wrong. This is one of the biggest mistakes my patients make. When you don't drink enough water, your urine becomes highly concentrated. This concentrated, dark yellow urine is full of waste products and is highly irritating to the sensitive lining of your bladder and prostate. This irritation can mimic the symptoms of BPH, causing urgency, frequency, and a burning sensation, making you think your prostate problem is worse than it is. Chronically restricting fluids in an attempt to manage your symptoms actually creates a vicious cycle of irritation and discomfort. The key is not to drink less, but to drink smarter. Aim to sip water consistently throughout the day, rather than chugging large amounts at once. This keeps your urine a pale, light yellow color, which is much less irritating. A good goal for most men is around 6 to 8 glasses of water a day. However, it's also wise to taper your fluid intake in the evening. I advise my patients to stop drinking fluids, especially alcohol and caffeine, about 2 to 3 hours before bedtime. This simple strategy alone can dramatically reduce the number of times you have to get up at night, significantly improving your quality of sleep and quality of life. Habit number 5. Ignoring chronic stress and poor sleep. We often separate our mental health from our physical health, but I am here to tell you they are deeply, inextricably linked. Chronic stress is a silent killer of prostate health. When you are constantly stressed, your body pumps out a hormone called cortisol. In the short term, this is helpful. It's the fight or flight response. But when stress becomes chronic, elevated cortisol levels wreak havoc. Cortisol promotes inflammation system-wide. It weakens your immune system, which is your first line of defense against abnormal cells, and it can disrupt your body's delicate hormonal balance. Poor sleep goes hand in hand with stress. It's during deep sleep that your body does its most important repair work. It cleans out cellular debris, balances hormones, and tamps down inflammation. When you consistently get less than 6 to 7 hours of quality sleep, you are robbing your body of this essential maintenance period. Your prostate, like the rest of your body, is left in a state of disrepair. You must make stress management and sleep a priority. This is not a luxury, it is a medical necessity. Find what works for you. It could be deep breathing exercises, meditation, spending time in nature, listening to calming music, or talking with a friend or therapist. Create a relaxing bedtime routine. Turn off screens an hour before bed. Make your bedroom a dark, cool, quiet sanctuary for sleep. Managing your mind is one of the most powerful things you can do to manage your prostate. Habit number 6. Misusing over-the-counter medications. This is a hidden danger that many men are completely unaware of. You get a cold or allergies, so you head to the pharmacy and grab a decongestant or an antihistamine. You take it, and suddenly your urinary symptoms, which were manageable, have become severe. You might even find you can't urinate at all. This is a common scenario we see in the emergency room. Why does it happen? Many popular over-the-counter cold and allergy medications contain ingredients like pseudoephedrine, a decongestant, or diphenhydramine, an older antihistamine found in products like Benadryl. These drugs work by tightening blood vessels to reduce swelling in your nose, but they also tighten the smooth muscle at the neck of your bladder and in the prostate itself. For a man who already has an enlarged prostate, this is like putting a clamp on an already narrow pipe. It can make a mild case of BPH suddenly severe, a condition known as acute urinary retention, which is a medical emergency. My advice is crucial. If you have BPH, you must read the labels on all over-the-counter medications. Avoid products containing pseudoephedrine. If you need an antihistamine, talk to your pharmacist or doctor about newer, non-drowsy options like loratadine or cetirizine, which are less likely to cause urinary problems. When in doubt, always ask. Don't let a simple cold turn into a urological crisis. Habit number 7. A low-fiber, processed food diet. We talked about what not to eat, so let's talk about what you absolutely need to eat. Fiber. The typical American diet, full of processed foods, white bread, and sugar, is notoriously low in fiber. This has a direct, physical impact on your prostate. A low-fiber diet often leads to chronic constipation. When you are constipated, your colon becomes full of hard, impacted stool. Because of anatomy, your colon sits right behind your prostate. This creates a constant physical pressure on the gland, which can exacerbate urinary symptoms and discomfort. Think of it as your prostate being squeezed from the inside by its own growth, and from the outside by a blocked-up colon. Furthermore, a healthy gut microbiome, which thrives on fiber, plays a huge role in regulating inflammation throughout your body. Processed, sugary foods feed the bad gut bacteria, which can promote systemic inflammation that affects your prostate. The solution is to fill your plate with fiber-rich whole foods. Aim for 30 to 40 grams of fiber per day. That means more fruits, vegetables, whole grains like oats and quinoa, nuts, seeds, and especially legumes like beans and lentils. A high-fiber diet not only relieves constipation, taking that physical pressure off your prostate, but it also nourishes a healthy gut, which is a cornerstone of an anti-inflammatory lifestyle. Habit number 8. Smoking and excessive alcohol consumption. This should come as no surprise, but we need to be specific about how these two habits directly harm your prostate. Let's start with smoking. It is, quite simply, poison for your circulatory system. The chemicals in cigarette smoke damage the delicate lining of your blood vessels, leading to poor circulation. As we discussed, restricted blood flow to the pelvis means less oxygen and more inflammation for your prostate. Additionally, heavy metals like cadmium, which are present in cigarettes, are known to accumulate in the prostate gland and are linked to an increased risk of prostate cancer. Quitting smoking is single-handedly one of the most impactful things you can do for your prostate and overall health. Now, alcohol. While a moderate amount, like a single glass of red wine, may have some cardiovascular benefits, excessive alcohol consumption is a problem. Alcohol is a diuretic, meaning it makes you produce more urine, increasing frequency. It's also a direct bladder irritant, which can worsen urgency and discomfort. And most importantly, it can interfere with your sleep patterns, preventing you from getting that restorative rest your body needs. My guidance is clear. If you smoke, get help to quit. It is never too late. With alcohol, the key is moderation. For men, that's generally defined as no more than 2 standard drinks per day, and ideally less. And remember our rule about tapering fluids in the evening. Alcohol is the first thing to cut out before bed. Habit number 9. Neglecting your sexual health. This is a topic that often makes men uncomfortable, but it is too important to ignore. There is a use it or lose it component to prostate health. Regular ejaculation, whether with a partner or alone, can be beneficial. The prostate's main job is to produce the fluid that makes up a large portion of semen. This fluid, or prostatic fluid, can sometimes stagnate and crystallize within the gland's many tiny ducts, potentially causing blockages and inflammation. The theory, supported by some significant studies, is that regular ejaculation helps to flush out the prostate, clearing this fluid, along with any potential buildup of inflammatory agents or carcinogens. Think of it as regularly cleaning out the pipes. One large long-term study from Harvard found that men who ejaculated more frequently, 21 or more times a month, had a significantly lower risk of developing prostate cancer. Now, this doesn't mean you must adhere to a specific number. The key takeaway is that a healthy, active sex life is a component of a healthy lifestyle, not something separate from it. It's good for circulation, stress relief, and potentially for the prostate itself. Don't let concerns about prostate health lead you to shut down this important part of your life. Habit number 10. The ostrich effect, avoiding your doctor. This is the most dangerous habit of all. I call it the ostrich effect, the tendency to bury your head in the sand and hope a problem will just go away. So many men ignore their urinary symptoms, writing them off as just getting older, because they are afraid of what a doctor might find. They are afraid of the digital rectal exam, DRE, and afraid of the PSA blood test. Let me speak to you directly from my heart as a physician. Ignorance is not bliss. Ignorance is risk. Yes, BPH is very common and benign. But the symptoms of BPH can overlap with the symptoms of prostate cancer. The only way to know what you're dealing with is to get checked. The PSA test, while not perfect, is a vital tool for early detection. And prostate cancer, when caught early, when it is still confined to the gland, is one of the most treatable cancers there is, with incredibly high survival rates. Putting off that checkup gives a potentially aggressive cancer time to grow and spread, at which point it becomes much, much harder to treat. Please, hear me on this. Your annual checkup is not something to fear. It is your most powerful tool. It's how you take control. Knowing your PSA number, having a conversation with your doctor about your risk factors, and establishing a baseline, that is how you protect yourself. I've had patients whose lives were saved because they came in for a routine checkup. We caught a problem early, and we treated it successfully. And I have seen the tragedy of men who waited too long. Don't be that man. Conclusion. From habit to health. So there you have it, 10 common habits that can silently undermine your health. From ignoring your bladder to ignoring your doctor. As we conclude, I want you to feel a sense of empowerment, not overwhelm. This isn't about being perfect. It's not about changing everything overnight. It's about recognizing that you are the CEO of your own health. It's about choosing to go for a walk instead of another hour on the couch. It's about choosing water over soda. It's about choosing a salmon salad over a steak and fries. It's about making that appointment you've been putting off. Each one of these positive choices is a deposit in your health bank account. Each one sends a message to your body that you are on its side. Start with one. Pick the habit from this list that feels most achievable for you to change, and begin there. Build momentum. Small, consistent steps, taken over time, are what lead to profound, lasting transformation. Your health after 60 is not a lottery ticket. It's a garden. Tend to it with care, and it will flourish. I'm Dr. Steve. Thank you for investing this time in yourself today. Stay informed, stay proactive, and be well.